Hey everyone, if you're having chronic leg pain and muscle weakness, you'll want to check out Bonnie's story. I'm Dr. Jason West. On this video, you're going to be learning about Bonnie and this patient success story where she literally limped in the office, and this was about 4 months ago, with severe non-functional leg pain. She's been dealing with this with most of her life, and we treated her with IV therapy, with neural therapy, a nerve reset therapy, some vitamin infusion treatments. She's had a remarkable outcome. So meet Bonnie, and then after the video, I'm going to tell you about this amazing therapy called neural therapy. But here's Bonnie, and I'm excited to share with you her story. Everyone, it's Dr. West and Bonnie inside the West Clinic. I'm excited for someone out there to hear Bonnie's story because it's motivating and inspiring, because Bonnie took control of her health, doing a whole bunch of really neat decisions of eating clean, drinking enough water, all that. But even better is her story. So I told her, let's share your story. So Bonnie, you first came into the office, what, about 3 or 4 months ago?
4 months ago.
4 months ago. And how did you feel when you came in?
I was really sick. I couldn't hardly walk. My knees were swelling. I had tried a lot of different doctors and was not getting any help.
And there was a diagnosis. Didn't they tell you you had a condition? What did they tell you you had?
They didn't.
Okay, so it was one of those things where she was a square peg they were trying to put in a round hole. For some reason, I got it in my head. I must be mixing it up with someone else, that it was a rheumatoid arthritis diagnosis. Obviously, it wasn't, or she would have said that it was, or like what the diagnosis was. But how she felt was, I can remember when she came in, she was like creaky. And what I mean by creaky is like when you went to move and walk, it took a lot of effort. It was like almost like a ratchet, like you'd move your knee and
Yes.
it wasn't smooth. And the medical recommendation, they had several different medication recommendations that didn't really line up or feel good to you. But what were some of the recommendations?
They put me on prednisone, and then that didn't work, so they put me on a methylprednisone, then they put me on a methotrexate, and then they wanted to put me on Humira.
So this pathway of, hey, let's knock down all the inflammation in your body, that'll fix everything. You didn't respond the way that was anticipated. So it's not exactly like you're in town. You come from a long ways away. How did you end up in the little railroad town of Idaho?
One of your patients,
Okay.
Denny,
right.
Preston.
So you had a referral to come.
Yes.
And when you came here, did you have expectations? Were you a little bit skeptical?
Very skeptical.
Okay, so you skeptical to come. And what did you think was going to happen when you got here?
I didn't really know.
Right.
But I was hoping
Okay.
for the best.
And we did a workup, and we said, hey, let's try and put everything in balance. Let's get you. And so some of the treatments that we did were what?
Diathermy, the neural.
Right. So the diathermy, guys, is an old school treatment to help inflammation and circulation. It's a physiologic therapeutic. And then the neural therapy is the bee sting therapy, where we're trying to get the nerves to open, close, and reset. And people have a love-hate relationship with it.
Correct. Yes.
Because it kind of hurts to do it and people have different pain thresholds, but there was some nice benefit to it.
Yes.
Okay, so she had some, and then we also did some infusion work.
Yes.
Right, so we did the vitamin C infusions, and then we did a series of treatments, and then what we wanted to celebrate today was the outcome that she feels now. So tell everybody what you experience now.
I can walk. My pain is a lot less. The Lyme's is under control.
So we found some infection markers in your system, and what was neat about that too is just you were already adhering to some really good lifestyle things. Like, you're not a sugar eater, you weren't on any junk food, you weren't drinking soda. And so this is one of the reasons why I just wanted to publicly tell everybody, one of the reasons why she responded so amazing is because she was doing a ton of stuff outside the office that made the treatments work even better. Because sometimes when people don't feel very good, they're like, well, I need to get an up, or I need, soda or caffeine or sugar. And how long has it been since you really had any sugar? Hasn't it been a long time?
A few months, but
Yeah.
I'm not a sugar eater
Right.
anyway.
So that's why I say that is because if anybody's out there that's watching this is like, man, I don't feel very good. One of the biggest steps that people can do is just to eat as healthy and as clean as possible. And Bonnie was doing that literally the whole time, and it's just a really, really fun story all the way around. So, Bonnie, one of the questions I ask people is that sometimes being sick or having a challenge teaches you something important or teaches you a life lesson. Is there a takeaway from the journey of not feeling very good that you either learned about life or you learned about yourself that if someone was listening, it might help them?
Seek out the best help you can get.
Right. Be your own advocate. Keep researching.
Right. And eat healthy.
I mean, it's perfect. Be your own advocate. Keep researching. Don't give up. Eat healthy. Bonnie, I just wanted to, like I asked you if we could share the story. Is it okay if we post it on social media?
Yes.
Okay. So Dr. J and Bonnie, the story is not feeling good for a long time, kept hammering it with anti-inflammatories in the medical world with, prednisone, methylprednisone, methotrexate. Couldn't walk about 4 months ago, and just amazing. Like if you guys could see her walk now, you would be shocked that she limped in 4 months ago. So everyone, this is Dr. West and Bonnie, and we'll see you guys on the next video. Thanks for watching this amazing success story. I've been helping patients across the street and across the country to overcome chronic health problems for over 20 years. And the key to health is it balances the body: sleep, water, healthy and alive foods, vitamin infusion therapy, nerve reset therapy, and regenerative injection therapy. That video tonight, that's what it's all about. And so if you'd like to know what neural therapy is, just stay here. If you have questions, you can check out my live show every Wednesday night at 6 o'clock at drjasonwest.live, or my podcast, Healthness to Wellness. It's on Anchor and Apple iTunes. Please give us a like and share, and if you click on the bell above, you'll get notifications about the patient success stories and our weekly webcast. You're not your diagnosis. There's a person in there, and if you treat the person, then people have the chance to heal. I've always said, live, just don't exist, and I will see you on the next amazing video. Ever wondered what to do about chronic healthcare conditions, chronic nerve pain, or literally how to turn off your system and turn it back on? Then this is a video for you. We're going to talk about neural therapy. Hi, this is Dr. Jason West, and I'm so excited to share with you a breakthrough in treatments for chronic disease, chronic pain patterns, chronic nerve problems, hormone imbalances, literally just about everything. And the therapy I wanted you to be aware of is called neural therapy. Now, how I describe neural therapy to patients in the office is it's kind of like a nerve memory or nerve dysfunction reboot system. Your nervous system has an amazing memory, and we never talk about this in the traditional medicine, and in most alternative medicine circles we never talk about nerve memory. Let me give you an example. If you walk into your home and your spouse or your mom or your children are making your favorite thing to eat, and you walk in and you're like, wow, that smells so good, and then about 30-45 seconds later your body doesn't recognize the stimuli anymore, and so what happens is you don't have that same smell, and then you forget about something. You go out, get something in the car, you take your garbage out, you take your dog on a walk, you come back into your home. Wow, that smells so good. What's happening is that stimuli is coming in and your body is saying, hey, this is a new stimuli. Now, another example of how your body can get used to things or how it can categorize things differently is through something called phantom limb syndrome. Now, what is phantom limb syndrome? What happens? I have a lot of ranchers and rodeo guys that come into the office, and one of them will come in and he'll have a rope caught around the finger, and the horse or the cow will take off and he'll pull their finger off, and they'll say, Dr. West, my finger is killing me. Or sometimes it'll happen in diabetics or an industrial accident where they'll have some type of accidental amputation, and they'll say, my foot's killing me, even though their foot isn't there. And the nerve is telling the brain that there's still this stimuli or there's still this pain pattern. Now, if your body was a computer and you called tech support and you said, my body isn't working right or my computer isn't working right, tech support would say, well, turn everything off and turn it back on. you can reboot the system. What that does is it helps the operating system to work better, and it gets rid of some lagging programs and some memory problems inside the computer. And I jokingly tease people, look, I can't really kill you and bring you back to life, but there is a way to reboot the nerves that control pain patterns and control organ function, and that's what neural therapy is. Now, neural therapy was pioneered in the 1920s and 1930s by a Dr. Huneke, and it was written about in a German textbook called the Manual of Neural Therapy, and it's this amazing Bible that we follow in the office. Matter of fact, my book is falling apart. I use it so much because I think it's helped me be a lot better doctor. Now, what neural therapy is treatment of the nervous system, and specifically addressing those nerve memory problems associated with chronic disease patterns. So if you've had a rash, or you've had a surgery, or you've had some type of irritation to the outside armor of your body or the skin, it can set up what's called an interference field. And this is one of the reasons why I think scar therapy is so important. If you have scars anywhere in your body, it's really important for those to get treated. And I have had some amazing patient outcomes just treating scars. Let me give you an example. I had one patient that had come into the office that had 6 lumbar back surgeries for chronic low back pain, and none of them had helped. She had tried physical therapy, she had tried acupuncture, she had tried chiropractic therapy, she had tried being active, and she was just miserable pain. And we had done everything that we could think of in the hospice, and one day out of desperation, I said to her, now tell me about when your pain started. And she said, well, it started after I got a lipoma removed. A lipoma is basically a benign fatty accumulation. They did a little surgical incision on 2 spots on her back. And he said, where does it hurt? She pointed to those scars. We treated the scars, and all of her pain patterns went away. It was an amazing experience that scars create interference fields, and any of those chronic areas where you're having disease, and it can set up a nerve memory, and then your body accepts that for being normal. And if you reset that with neural therapy, you can get some amazing outcomes. Now, here's what you do with a neural therapy. Take a real small syringe, a little tiny dental needle, and you inject either the scar areas or the areas above the organ that's not functioning right. So you can do this for kidney problems, you can do this for heart problems, you can do this for chronic pain problems. It feels like little bee stings. It's an annoying treatment. And the medicine that you use is a glycolized ester of para-aminobenzoic acid, which is a huge mouthful. But really what it is this amazing medicine called Procaine. And what Procaine does in the right application is it makes your nerves that control the organs and the tissues open, which we call hyperpolarization, close, depolarization, and then normalize, what we call repolarization. So you can actually reset the nerves for headaches, for chronic regional pain syndrome, for sciatica, for carpal tunnel, for liver problems, for stomach problems. And we've got hundreds of patient testimonials where we use the application of neural therapy to help resolve chronic problems. Now, when you do that and you change lifestyle, you put good building blocks in the system, you get your body on a schedule, you get oxygen, you get enough water into your system, you can take healthcare conditions that didn't have any medical options, that were out of hope, were out of time, basically the patient's at their wits' end, and you can get those patients to turn around. And those are most of the people that we see in the office. We just don't have any other medical options, or we exhausted everything, or we're tired of the prescriptions, or we don't want to do surgery. And this is a wonderful therapy if you have any of those conditions. So neural therapy is a way to reset the nervous tissue. It's been doing about 100 years in Germany. It's just starting to come to America. More and more people are doing it. It's one of the neatest treatments that I've seen in my office. Neural therapy is one of my favorite things that help people with chronic healthcare conditions, chronic nerve pain, and hormone imbalance.